Americans wishing to get COVID-19 booster shots could be gaining more flexibility when they roll up their sleeves once again. The New York Times reports the Food and Drug Administration is about to give the green light for fully immunized people to receive a dose that does not line up with what they originally received. CBS News' Skyler Henry has more.
The FDA could be set to approve the mix and match use of COVID-19 vaccines as booster shots.
I think what the FDA is going to say is they're going to make it easy. You can get a different booster if you want, but we're going to recommend staying with the same brand if you can.
The New York Times reports the move could come as soon as Wednesday, and an FDA spokesperson confirms the agency has the power to make the authorization if it feels it's needed.
In the real world, all these kind of combinations or extra boosters are already happening. So I think it's a matter of some urgency.
An FDA official hinted at the move during a hearing Friday, where an independent advisory committee approved a second dose for people with the Johnson & Johnson vaccine.
Dr. Marks, is it possible that there might be an EUA down the road, not necessarily right away, about the whole mix and match strategy?
I would say it's possible.
That's all I wanted to hear.
The FDA approval for booster shots comes as tensions are on the rise for a minority of Americans who are holding out from getting their first vaccine doses. Thousands protested in California Monday, saying kids should not be kicked out of the classroom because they're unvaccinated.
I am vaccinated, but I do think that people should have a choice on whether they get vaccinated or not, because the vaccine has been out for that long.
And in Chicago, the city has begun placing some police officers on unpaid leave for failing to update their vaccine status. Those officers could eventually be fired. Skyler Henry, CBS News, Silver Spring, Maryland.
For more on this, Dr. Theodore Strange joins me now. He's the chair of medicine at Staten Island University Hospital in New York City. Dr. Strange, welcome. Explain the science behind this plan, if you will. Why does mixing and matching seem to be okay for booster shots? And would you recommend it?
So I think, again, always we have to follow the science and the data. So the recommendation is going to be what I would recommend that comes out of what the FDA would say. So the reason there was concern or there was some issues about looking at this was because there were different types of vaccines, and this new mRNA technology, which was out of both Pfizer and Moderna, were slightly different. The Janssen vaccine was a more traditional vaccine, and so there needed to be some data to support that the antibody response, in other words, what you were looking for, was going to actually occur by mixing and matching some of these and then making sure that we got the most effective dose. I would say that in the best scientific way that I could think about this and what I've seen the data show so far is that the mixing and matching, especially of the mRNA technologies, both Pfizer and Moderna, probably will not be an issue. I hope that it does work for the Johnson & Johnson vaccine also, because it would just make that one much more usable, because that's the one we've gotten to more difficult populations, more patients who have not been in areas where it's been as easily as accessible. So I think let's follow the science, let's follow the data, but I'm pretty confident that we're going to be able to mix and match.
Yeah, well, that's my next question to you. Because of the mRNA science, which is in the Moderna and the Pfizer, and like you said, the J&J is a more traditional vaccine, is the science showing us that you can mix those three up, or should you stick to, let's say you had Pfizer, should you stick to a Pfizer or Moderna booster, and if you had J&J, stick to a J&J?
So I think right now, if you have the opportunity and it's easy enough to do, to stick with the vaccine that you got. I had both of mine, Pfizer's early on in the year this year, and I just received my booster shot actually this past Friday. As a healthcare worker, we've been asked to do that, and I took the Pfizer again. Right. So I think if the opportunity presents itself to take the same vaccine at this point, I would do that. However, I think over the next couple of days, week, there may be some good data, and I think you may see the approval by the FDA to approve the mix and match, which is, I think the New York Times may even be reporting that today.
Right. So, Doctor, with the death of Colin Powell yesterday, there's been much more discussion about boosters for those who are immunocompromised, as the general was. He was, of course, fully vaccinated, but was battling this blood cancer at the same time. So why is it so important that this conversation specifically is being, made public in regards to COVID and the vaccination effort?
So that is a great question, and that is something that this is the reason why we need to get people vaccinated especially not just for yourself, but for all around you. There is nothing 100% in medicine, and vaccinations are just a part of that. We know that Moderna and Pfizer probably are somewhere in the 80 to 90% efficacy. The Johnson vaccine, 75, 70% efficacious. The boostering of these is important, especially with the Delta variant, which has a infectivity which is markedly greater, as much as the infectivity equaling that of the chickenpox virus. And we know that people like General Colin Powell, such a great American, who had a blood disorder and an immune disorder which probably let his immunity wane or did not protect him as well as everybody else. And therefore, the immunizations were not as strong in him. And hope if he would have gotten the booster, maybe it would have helped him. But if you were to come in contact with patients such as him, which you don't know when you're walking around a shopping mall, when you're in your local church or synagogue, when you're just at a local party, who has, who hasn't, what medications people are on that are compromising their immune systems, what other diseases they have, that you may be putting them at risk. So, yes, we have a right in this country to make our own decisions about our own bodies and choices, but we also have a responsibility. And that responsibility is to all of those people we interact with. And just think about your family, your grandma. Just think about your wife, your children. Just think about others you interact with who you may not know what their medical conditions are. And if you were the one who happened to be carrying the COVID vaccine or have the disease, especially in an asymptomatic way, and shedding it, you know, that could be the deadly bullet for that person who, as General Colin Powell did, succumb to the disease yesterday.
Right, absolutely. No person is an island. Doctor, Americans are already getting their flu shots ahead of winter. And additionally, of course, some people may be considering other vaccines like the shingles vaccine for older Americans. So how would you recommend people in these situations prioritize their vaccination schedule? Can you do all of these, vaccinations at once?
Sure. So again, great question. I'll make it personal. My wife and I took our shingles vaccine right in the middle of the pandemic last year. So I took my COVID vaccine in December, January. I had my shingles vaccine in February and June. I had my flu vaccine last year in October, November. I just did my booster and my flu vaccine same day last Friday. So there is a lot of data to support, and we've been doing this for years, other than live virus, which none of these vaccines are, that you could co-administer at separate sites, both arms, vaccinations without any issues. You may have some local side effects. We know that the COVID vaccine may cause some systemic, malaise and fever and headache for a day. But most of these vaccines, it's a self-limiting issue, and it goes away in 24 to 48 hours. And the recommendation is that you can administer, for sure, the flu vaccine and COVID vaccine, especially now that we're giving boosters, on the same visit, no issue. If you're concerned, separate it by a couple of weeks. Do I administer 3 vaccines in a day? Rarely do I do that unless somebody needs it for travel purposes or other things like that, just because. But again, other than live vaccine, which none of these vaccines are, you can administer 2-3 vaccines in a day. Pediatricians do this all the time. The Army, the military does this all the time. So this is something safe. It makes it easy for patients, and the downside is very little to none, but the upside is huge. And we know that we're coming into a flu season potentially, I say potentially, that if it were at all in any way the way it was a few years ago in the middle of a COVID pandemic, it would be horrific and detrimental, but not only to patients, but to the healthcare industry. If we do the right things, wash our hands, continue to somewhat remain socially distant, and I'm not suggesting we all have to live in cocoons, wear our masks in the appropriate places, we may get through another great flu season. We had no flu season last year. In part, it was because we were living smarter.
Well, doctor, that was going to be my next question to you about looking ahead, because new COVID cases and deaths have been steadily declining happily since this most recent wave peaked in September. But again, the holidays are coming. Like you said, the colder weather is coming. And on top of that, I wonder if you worry that, especially in these big metropolitan areas where people had a wave of vaccinations, we're getting into our sort of 7-8 month, period where some of that protection might be waning. So do you think all of this could portend a not so happy winter?
I'm an optimist, so I'm going to look at the cup half full. We want to continue to be smart. We want to follow the science. That's what I've always said. This is not a political virus. None of these are. This is a medical virus. This is a medical disease. These are medical diseases. We know that we can decrease the amount of, I use the word, mortality and morbidity by giving vaccinations. We know that well with the flu. Do we prevent all flu? We do not. Do we decrease the amount of deaths and decrease the amount of hospitalizations? We absolutely do. And we do the same for corona and COVID. So yes, we're coming into a period of time where we're going to get all back inside. We're going to be in closer quarters together. I think that there's nothing wrong, especially if you have some pre-existing illness or you're on an immunocompromised medication, chemotherapy and the like. Put a mask on when you're in environments where you're not sure, where you're around people that are in more closed environments. I would hope that family gatherings are all going to come together where all the family understand and hopefully are immunized for grandma's sake, for mom's sake, for whomever's sake.
Just
That's what the holidays are about.
Take care of yourself and your family. Dr. Strange, thank you so much for joining us. As always, we appreciate your medical expertise.
And I appreciate you getting out the great word out there. Thank you for what you're doing, too.